Hi, I'm Dr. Dan Rubin. I'm here at the 2020 Annual Convention of the Oncology Association of Naturopathic Physicians here in Scottsdale, Arizona. And I'm sitting here with Dr. Dugald Seely, the current and new president of the association and the founder and executive director of the Ottawa Integrative Cancer Center in Ottawa, Canada. Welcome.
Thank you. It's great to be here to talk to you. Yeah.
Awesome. Really excited because OncANP has the first ever Canadian president.
Yeah. Yeah, it feels like a neat and a good development for the association, and I've been involved for a long time. I think we've got about a third of us that are actually Canadians in the organization, so feels good, and lots of amazing leadership that's been through it in the past. So it feels like big shoes to fill, and kind of a new ways to venture forth, hopefully into Canada a little bit more. Anyways.
I'm excited too to see some new directions and to see where OncANP goes. And you've been with the Oncology Association from the very beginning, I understand.
Yeah, I remember the first meeting, I think it was in 2004, and where it was just coming together, and you and a number of colleagues were just getting this off the ground, and I remember just being so excited at that time.
Wow, wonderful. When did you become board certified as FABNO?
I believe it was 2013. I'll have to fact check myself later, but yeah, I think
and you've
that's
also
right.
been on the board of directors of OncANP for a little bit of time, correct?
I have, yeah. This will be my fourth year, I believe, yeah.
Excellent. Research. I know you're very research oriented. You've done amazing and immense things for this profession, and I've watched your career. I've watched your research. I've watched the publications you've had. I'm a huge fan. I love it. I love reading your work. And I don't know a whole heck of a lot about your clinical facility, the OICC. And I'm curious, when was it founded? What was the development? I'd love to hear the story.
Yeah, so we opened our doors back in 2011 and basically opened up the clinic in Ottawa, which is about 4 hours from Toronto. Okay. And this was with the support of a foundation and with the Canadian College of Naturopathic Medicine. And yeah, so basically our focus is on cancer care. We've got about 15 different practitioners, actually 4 NDs. Right now we're going to be bringing on another one. Okay. A medical doctor, a psychiatrist, a nurse practitioner, acupuncture, so a whole sort of variety, a multidisciplinary practice. Focus on cancer, and then we are also engaged in doing research at the clinic as well.
Do you have any current research interests right now at the center?
Yeah, we do. Actually, one of them, we're going to be one of the clinician scientists, Dr. Conti, is going to speak about this tomorrow, but we have a study looking at thoracic poise, which is essentially an integrative, pragmatic clinical trial looking at the inclusion of naturopathic medicine alongside conventional care for patients with thoracic cancer. And so this is a long study looking essentially at proof of principle to see if naturopathic medicine, naturopathic oncology, as a component of conventional care, can actually have an effect on quality of life, survival, perioperative outcomes, a whole battery of different outcomes that we're looking at.
I have 2 questions for you about that. One, what exactly constitutes thoracic cancer? If you could explain that. And number 2, is this, the POISE trial, is this doctors giving certain particular supplements or nutritional interventions or lifestyle interventions to be studied, or is it physician's choice, basically?
Yeah, great question. As far as the thoracic cancer component goes, we're including those with lung, gastric, and esophageal cancer. So those 3 types, all of whom have to be eligible for a surgical resection as well to be in the study. And then the intervention or the treatment approach that we're giving is really based on, there's a number of core supplements that we're using. And then we are also layering in sort of mind-body component, things like breath work and meditation, and then we have exercises and nutrition. So trying to be holistic, but we're also trying to be sort of semi-standardized, so it's not, so it can be replicated.
Right, so the physicians pick from a list of things that are eligible to be utilized.
Kind of, yeah.
Wonderful.
Yeah.
And breath work, genius, because this is where you breathe.
Yeah.
Excellent, that's the thorax.
Yeah.
Very good. Well, I can't wait to see the outcome of that. That would be great. When do you expect the outcome or the study to be completed?
So we've just we're wrapping up our feasibility study right now, and that's non-randomized. And from that, we're sort of looking at the interventions, making some changes. Then literally, we're going to have 5 years of recruitment and follow-up. So we're looking at least, I'd say, before any results are going to be available in the long term for like 7 or 8 years. So it's going to be a while.
But that, and this is for the audience out there who might be looking at this and maybe a little bit unfamiliar with clinical research, 7 to 8 years from like right now seems like a long time. And I'm assuming, one, this has been in development for quite a while.
Yeah.
Is that, to conduct a study of that magnitude for that type of outcome, which is fairly personalized and individualized, which is no small task, is 8 to 10 years unheard of, or is it extremely long, or is it relatively usual?
I'd say it's relatively usual, and probably that may even be a little earlier than what will actually be the reality.
Okay.
We just finished a study on melatonin for non-small cell lung cancer that has gone on for 12 years. And so,
wow.
Yeah.
But
so
that's
actually,
good because it follows people for a long period of time, so you understand how things actually work over the long term.
Yeah, that's the goal. I mean, it's especially with longer term outcomes like survival, it takes a lot of time to get the patients and then to follow them. So.
And you have to have patience with a CE.
Yeah.
Patience. Wonderful. Well, thank you
Yes.
for sharing that. Regarding OncANP, any thoughts on the future, or what you'd like to do with your presidency of the OncANP, and where you'd like to help direct the association?
We just had an amazing board meeting retreat just yesterday, in fact, and looking at what kind of things that we want to move forward with for our next sort of 3-year work plan. And we're looking at growth overall for the membership and the impact of the association, building alliances and partnerships with other groups that are like-minded, that are in the practice of integrative oncology. And then building on the science and the education that's been so well done, like this conference, but carrying that forward and seeing what ways that we can move it forward as well.
Excellent. Can't wait to see the future.
Thank you.
Great. Well, thanks for being here.
Thank you.
Thanks.